According to a study covering 118 low and middle income countries by the Johns Hopkins Bloomberg School of Public Health, an additional 1.2 million under 5 deaths could occur in just 6 months due to reduction in routine health service coverage levels and an increase in child wasting. Today on Sound Health, our focus is on the impact of COVID-19 on children. I am Olasunbo Modupe. Welcome to the show.
Two new laboratories have been activated for inclusion in the Nigerian Center for Disease Control Molecular Laboratory Network. They are the Federal Medical Center Birnin Kebbi and the Plateau State Human Virology Research Center Plateau. Testing for COVID-19 is free at these laboratories. The Lagos State government has announced dates for the resumption of public and private schools. According to a statement by the Commissioner for Education, Mrs. Folashade Adefisayo, the ministry is adopting a phased approach to the reopening of public schools in the state in order to enable them meet COVID-19 physical distancing rules and safety protocols. She noted that the state government strongly implores school owners to institute all necessary safety protocols as well as resume in phases similar to the plans for public schools. Adefisayo said phased opening includes strategies for staggered resumption in the mornings, classes on alternate days during the week, and teaching through various distance learning methods. She added that schools must also comply with safety protocols and hygiene guidelines as instructed by the state government through the Office of Education Quality Assurance, which will also continue to monitor and evaluate schools' preparedness. The Commissioner emphasized that pre-primary classes in both public and private schools will remain closed until further announcements are made and reiterated that the pandemic still exists, urging all stakeholders to prioritize the safety of the children, teachers and parents. Globally, there have been more than 29 million confirmed cases of COVID-19, including over 900 deaths reported to the World Health Organization. In Nigeria, over 56,500 cases and more than 1,000 deaths have been confirmed.
It's still Sound Health on Lagos Television. Dr. Peter Ubuane is joining us via Skype to look at the impact of COVID-19 on children. Dr. Ubuane is a consultant pediatrician at the Lagos State University Teaching Hospital. Thanks for joining us, sir.
Thank you for having me on the program.
From the statistics so far, what is the risk of a child contracting COVID-19?
All over the world, the risk of children acquiring the infection is comparatively lower than that of adults. It's a good thing to know. You recall that earlier predictions were looking very ominous for children and as well as other populations. We are happy to note that children are less likely to be infected and less likely to be adversely affected too.
Okay, are children any more or less likely than adults to spread COVID-19?
Yes, that's also true about children. There's always been this fear that children, because they mingle a lot, are more likely to transmit the infection. But data available from different parts of the world actually shows that children are less likely to transmit the infection to other age groups.
Okay. How do you?
On the contrary,
Okay.
infect children.
Okay. How do you know when a child is infected? Can similar symptoms be regarded as COVID-19?
Generally, it's not a straightforward thing. COVID-19 tends to present like most common infections of childhood, such as it could present fever that may mimic malaria, it could present with cough that may mimic common viral infections of the lower airway. But in the setting of this pandemic, such children, there's some degree of, there's a sort of high index of suspicion that could alert the health worker. But most infected children are actually asymptomatic. In short, a larger proportion of children are asymptomatic, do not have symptoms compared to the adult population.
Okay. Are the symptoms in adults different from children? From your perspective or experience, are the symptoms different?
Generally, the symptoms are similar: fever, cough, fast breathing. But in terms of proportion, children are less. A smaller proportion of children are more likely to have each of those symptoms. And then symptoms, children are even more likely to have uncommon symptoms. They could have fever, they could have diarrhea. So the proportion of those that manifest with symptoms like diarrhea is higher in children compared to adults. But generally, the symptoms are similar to those of adults.
Okay, tell us, Dr. Ubuane, is a child with underlying medical condition at higher risk of contracting COVID-19?
Maybe I'd rather say that a child with underlying children with underlying comorbidities, they are more likely to be adversely affected when they get infected compared to children that don't have those underlying comorbidities. And that is similar to what has been reported in the adult population. And that is the reason why the principle of shielding, trying to protect such children from needless exposures, that's why that principle has come up.
Okay. How do you prepare as well as prevent children if a member of the family has COVID-19? Especially now that we are now practicing home-based care.
Well, if a member of a family is positive, that would mean that that person has been tested and has been found to be positive. So that will require notification of the appropriate health authorities who will assess the risk. Of course, some people that are asymptomatic or mildly affected are sometimes asked to stay at home. But there needs to be proper notification so that the risk of transmission in that particular family is properly assessed by the appropriate authorities. You know that the home environment of individuals are not the same. The risk of transmission in somebody who stays with a large family in a single room is not the same as that of the person that has other people staying with him or her, and they have a bedroom apartment. So those are considerations that come into play. Even where such persons have been allowed to stay at home, to isolate at home, the principles of physical distancing, wearing of face masks have to be followed as recommended by the appropriate authorities watching over such treatment.
Okay, Dr. Ubuane, what steps should be taken if a child is sick with symptoms of COVID-19?
The first thing is that if a child has symptoms of fever or while one may suspect COVID-19, that should not be the conclusion. They should go to the to the appropriate hospital where the child will be assessed. There are screening tools that the health professionals will apply on the child and take the necessary steps that may entail quarantine, that may entail requesting for the definitive test. So people should not, where there are suspected symptoms, the symptoms that meet the criteria, which includes cough, fever, cough, generally fever, cough, and fast breathing. Such children should be taken to the hospital so that the health workers can assess them and take the appropriate steps.
Okay, what is the level of survival in children if a child contracts COVID-19 now? What is the level of survival?
It's quite heartwarming to know that this level of survival in children has been very fantastic. All over the world, children are less directly affected by the infection in terms of hospitalization, in terms of deaths. There have been very few reports from different parts of the, even in the hard-hit areas of the world, relative to the mortality in adults. The rate of mortality in children has been very low, and that's quite heartwarming.
Okay, according to UNICEF, a small percentage of minors who test positive for COVID-19 develop a life-threatening condition called multi-system inflammatory syndrome in children, and it is unclear if the disease has other long-term consequences. As an expert, what is your take on this, and what is the way forward?
Yes, in the wake of the pandemic, shortly, particularly in the earlier reports were from Italy, the US, and the UK. They noticed that they started seeing children presenting with an entity known by that name, and they paid closer attention to it and came up with some diagnostic criteria. What that portends is that beyond the acute phase of infection, people that have recovered, even those that are asymptomatic, we need to pay close attention to them. That entity, that syndrome, which has been described more in children, of course, there are similar entities being described in the adult population now. So what it means is that those who have been infected, who have turned out to be positive, whether they are symptomatic or asymptomatic, they need to be watched. We need to monitor them and to be sure that they are not going to have some other complications later on in life, maybe in the coming months or even years. So that's one of the challenges that the health workers are looking at, that beyond just treating the acute infection, we need to monitor them into the long term and be sure that there are no what we know as post-inflammatory syndromes.
Okay, so are there long-term consequences?
Yeah, the pandemic is still young, if I must use that term. The pandemic is still young, but preliminary findings seem to suggest there could be long-term consequences. Some survivors have reported a sort of fatigue that have even, especially in the adults, that have lasted weeks or even months. So that means that there will be some long-term consequences. But like I said, the pandemic is still less than a year old, so it's difficult to say. But deriving from experiences from similar outbreaks, there is need to actually watch out for possible long-term consequences like impact on the lungs, impact on the heart, and impact on even the immune system. So that may also apply to children. But it does appear that children may do better than adults, even in the long term.
Okay, Dr. Ubuane, let's look at some precautionary measures now. Can children wear face coverings like masks?
Yeah, with some flexibility, children can wear face masks. What some nations, some institutions, and some professional bodies have generally recommended is that children above 2 years can wear face masks. Though recently the WHO also actually said that children above 5 years should wear face masks rather. But with the proviso that those that are between 2 to 5 years should be decided on a case-to-case benefit. You have to weigh the risk of wearing face mask. But I think from my experience, children above 2 years, they can't wear face masks. Just make sure that the face mask is not too tight and the child is comfortable with it. And they should be taught accompanying practices such as hand washing, as much as the developmental stage can cope with that.
Okay. Can children be allowed to mingle with their friends now, let alone adults with chronic health conditions?
Well, what I would say on that is, number one, is that the public should follow the guidelines that are being released and regularly updated from the governmental agencies in charge of the guidelines. There's still need for all this precaution. Though in this part of the world, Africa generally have been led scattered by the pandemic. But there is no room for complacency. You go out in the community, you see a lot of people not wearing face masks. That's not good for us. So for children, we should still maintain the precautions and ensure that outside the home there is controlled association. As much as possible, children should still be restricted in the mixing while we are paying attention to the recommendations from the NCDC, from other professional bodies that speak into the well-being of children.
Okay, still on precautions. How safe is it for children to use alcohol and rub?
When used, of course, children can be very adventurous and they could play with a lot of things. Particularly for the very young ones, one needs to be careful. Sometimes alcohol can be absorbed through delicate skin. So what I would say is to use them appropriately. Maybe for children, for the younger children, they should be encouraged to do more hand washing. But they can also use alcohol-based hand sanitizer, but not overusing them.
Okay. Is it safe to take children to hospitals now? Because I know some parents have stopped taking their children to hospitals for routine immunization. Is it safe to take children to the hospital now?
According to the World Health Organization and also the International Paediatric Association, the benefits of immunization actually outweighs the supposed risk. The real risk of getting infected, even in the healthcare setting. So far, appropriate precautions are taken. So depriving children of vaccination can be very, very risky. The risk of children actually getting infected can be mitigated further by the parents wearing face masks, and the hospitals are put in place precautions to safeguard the health of their clients accessing such important services. So I want to encourage parents to keep on with the immunization schedules of their children.
Okay. As the world awaits the arrival of a vaccine, in the eventuality of one, should parents allow babies, toddlers, or children for clinical trials?
Well, that's a hard one. Children, individual parents will have to make that decision. And if such a clinical trial, of course, I'm aware some clinical trials are ongoing in Nigeria, not specifically for vaccine, to the best of my knowledge. I believe the appropriate regulatory authorities will protect the interests of children and the rights of parents to decide will be protected. They will be given all the information and they'll be allowed to make informed consent.
Okay, we all know how difficult the new norm is. How do you encourage and ensure children adjust to these new settings?
Yeah, it's been a difficult time. Children have been at home since in our country since for about
6 months.
for close to 7 months. Children have been at home, so that has been hard on them. They've not had the experience of going to school. So parents I believe they are trying to cope with the new norm. So they should just endure more. I think things are going to get better along the line. But my word for the parents will be to keep practicing positive parenting and to keep providing for the emotional and the nutritional needs of the children, and as much as possible, the academic need of the children.
Okay, sooner or later, children will be back in school. What advice do you have for parents, students, caregivers, and school authorities?
Yeah, I believe the appropriate authorities are actually looking into that and are watching out of different fronts what should be the appropriate steps. It's not always a straightforward or easy decision to take. There's a lot of engagement with different authorities, stakeholders, looking at the changing pattern of the disease, the burden, the transmission, and weighing the risk and benefits. So what we should do on the part of the school authorities, like I mentioned earlier, they should look at the guidelines that have been published by the NCDC and make sure that they are putting in place those measures. On the part of the parent, they should keep educating the children, training them on hand washing, reinforcing those little habits, encouraging those who are old enough, always encouraging them to wear face masks when they have to leave the house. And so everybody joining hands and watching out for for the phase opening of the educational system. I think we will have good outcomes.
Okay, thank you so much, Dr. Peter Ubuane, for your expertise and time on sound health.
Thank you for having me with you.
We have been talking to Dr. Peter Ubuane, consultant pediatrician at the Lagos State University Teaching Hospital, on the impact of COVID-19 on children via Skype. Sound Health continues in a moment. Following guidelines to prevent the spread of the COVID-19 virus can be particularly difficult for children. Stay patient, be a good role model, and your child will be more likely to follow your lead. This is where we wrap up today's episode. For comments and enquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.